Hi everybody, this is Dr. Ihab Abdurrahman Ihab Tarawa, consultant of acute care medicine at Soba University Hospital, professor of medicine, University of Khartoum. This session is about understanding medication safety. It's part of course of medication without harm. Learning objective, explain why medication errors occur, discuss significance of medication errors, recognize your individual responsibility in ensuring medication safety. We'll start with this scenario. Muhammad Ahmed Ali, 56-year-old man with diabetes, hypertension, post-operative for hip replacement, on Lantus 20 unit daily, regular insulin 15 unit before each meal, plus correctional insulin, what we call nowadays insulin sliding scale. His regimen, as shown here, his blood sugar now is 320, so he is supposed to take 8 unit plus the pre-meal, and this will end up to be 23 units. Ahmed Muhammad Ali, he is 52 years old, man with hypertension, post-operative hyperglycemia. He is not diabetic. Post-operative hip replacement, 3 days, and today his sugar is 210. He was also supposed to receive correctional insulin, and according to his sugar, he's supposed to get 2 units of regular insulin. Muhammad Ahmed Ali, the first patient, unfortunately received only 2 units. He received the dose supposed to be given to the other patient, and this didn't correct his blood sugar, and subsequent blood sugar check showed that the blood sugar is 480, so the blood sugar increased. While the second patient received a higher dose, instead of 2 units, he got 23 units, and he developed convulsion and aspiration. So please explain the consequences for each of these actions. For the patient, patients are harmed. The first one experienced more hyperglycemia, and the second one experienced severe hypoglycemia and convulsion and aspiration. This is my prolong his hospital stay, and it lead to financial burden plus other complication. The provider, when we do error, we feel guilty, and the system loss of trust in healthcare system, and this can lead to medical legal action and litigation. What is the impact of medication error in this patient in general? Medication error may result in an adverse event where patient is harmed, near miss, a close call where patient is nearly harmed, neither harm or potential for harm. The term medication error is often used to refer to failure in the treatment process that lead or has potential to lead to patient harm. Medication error may arise when healthcare professionals fail to complete a planned action, omission error, or fail to complete planned action correctly, what we call commission error, when he give wrong medication to wrong patient, wrong route, wrong dose, and wrong time. Omission error is failure in planning, خطأ في التخطيط. Commission error failure on action وخطأ في التنفيذ. For our patient, what happened was a commission error. The patient received wrong dose. The use of medicine in hospital is very complex. It involves multiple healthcare professionals, a resident, specialist, consultant, pharmacist, pharmacy technician, nurse, nursing student. It involves multiple steps. It can be up to 60 steps for a single prescription. The complexity of this process may cause medication-related harm. Mistake may occur at any point in the medication use pathway when medication is prescribed, dispensed, administered, or during monitoring phase. This showed that the different phases: prescribing, dispensing, administering, and monitoring. In prescribing, there are many phases: patient evaluation and make a diagnosis, establish the need for medication or alternative intervention, select the appropriate medication, individualize medication for that patient, then prescribe the medication, and you have to comply with the prescription requirement. Dispensing, then the pharmacist reviews the medication and make sure it's appropriate to the current diagnosis and with the current patient status, prepare and dispense the medication, then he delivers the medication to the nurse, or in case that the patient going home, he give it to the patient or the carer. Administering, then the nurse reviews the medication again, review it is related to the diagnosis and it's appropriate to the patient condition. Then she prepares the medication, she administers it and documents that medication was given. And finally, all of us, doctor, pharmacist, nurse, and patient should monitor this process. To show these multiple and complex steps, let us go through this journey when we will evaluate the patient, current clinical status, what we find on observation, what are the lab tests and radiology workup. Then we have to formulate a differential diagnosis, and then we need to act according patient medical history, and we need also to get medication history from a reliable medication history from more than one source. After that, we need to establish need for medication, consider potential treatment, drug or non-drug, determine the appropriateness of continuing existing medication. For example, patient with hypertension, when they are in shock, you might need to hold the antihypertensive. Discuss choice of treatment with the patient and family member whenever this is possible, and document treatment decision in the medical record. As you know, as far as now, in these two steps, we are going through almost 9 small steps. Then you select your medication based on efficacy, safety, interaction with other medication and patient condition, the convenience, cost effectiveness, availability, and this include local formulary. And also you need to comply with local guideline and international guidelines. You need to assess the patient allergy, and other comorbidities might dictate that you need to modify your dose. After that, we have to individualize medication for our patient, suitability based on patient factor according to his liver and kidney function, his age, his weight, and what we see in current observation. Consider interaction and possible side effect, determine suitable dose and frequency. After that, we have to prescribe clearly and legibly in accordance with the national guideline. You need to write the medication in generic name, appropriate dose, appropriate route, and frequency. And if the medication is as needed, you have to indicate that. If it's short or long acting, you have to indicate that. And indicate all these in the patient medical record. Include medication for include the indication for the medication. Sometimes this helps other people, the pharmacist and nurse, to make sure the dose is appropriate. For example, ceftriaxone in pneumonia or meningitis has different doses. Document treatment plan in the medical record. Dispensing, the first step in dispensing is to review the prescription. The pharmacist ensure prescription is unambiguous, check suitability of medication of choice, and the route, the dose, the frequency, it relates to the patient illness and condition and other comorbidity. Consider interaction and potential side effect, and also according to the patient age, weight, and allergy. Where information is available, consider comorbidities, current clinical state, including test result and observation. Contact prescriber for any discrepancy or concern. Then prepare and dispense the medication. Ensure correct product is selected. Check the medication. Ensure the dose, the form, the strength, and check expiry date. Make appropriate labeling on the product, and with patient name, medication name, strengths, and direction of use, and include ancillary labels. After that, you deliver that medication to the nurse. Ensure timely delivery of medication to the correct patient or to the designated area. When the nurse receives the medication, she needs to review the prescription, ensure prescription is unambiguous, check suitability of the medication according to the dose, frequency, timing, route, consider interaction and potential side effect, and where information available, she should check for comorbidities and contact the prescriber for any discrepancies. After that, the nurse needs to prepare the medication, ensure correct product, and according to the name, dose, frequency, and strength. Sometime calculation needed according to the concentration, and contact prescriber or pharmacist for any discrepancy or concern. After that, she will administer the medication, identify the patient using their full name, medical record number, date of birth, and at the patient bedside, check prepare medication against medication order. Check by second person in high risk medication. Double check what we call the redundancy to make sure more safety measures are implemented. Check route of administration. Provide information to the patient about medication being administered. Then sign the chart that the medication was given and time that. If the medication is not administered, use relevant code to identify reason on the medication chart and document in medication record why not it was not given. Then we have to monitor. Monitoring is responsibility of all the members of the healthcare team, the doctor, the pharmacist, the nurse, the patient, and the carer. It is everybody's responsibility to monitor the patient for desired and undesired effect. Review whether desired response achieved, not achieved, and document in the medical records. Adverse effects should be documented in medication chart, in medical record, and assessed by treating team. So medication safety is everybody's job. Medication safety is everybody's responsibility. Avoid blaming and shaming. Report error whenever it happens. Open disclosure is also important and is a source for learning. In summary, medication errors are common source of harm. Many incidents are avoidable. Medication safety is everybody's responsibility. Medication pathway is a complex process, and it involves prescribing, which include patient assessment, establish the need for medication, individualize drug selection, then prescribing. Dispensing, review the prescription, prepare, dispense medication, and then deliver it to the nursing station. Administering, review, prepare, administer, and document. Monitoring, which is a responsibility if everybody gets their family informed and engaged. Thank you, and see you in the next session.